Alexander's ragtime band.
The year 1914 is most often associated with the start of World War I. But it was also a year of incredible change that jump-started the modern cultural era. Henry Ford introduced an assembly line for the Model T. Charlie Chaplin captivated audiences and defined the golden age of silent films. And the Utah-Idaho Hospital opened its doors as Cache Valley's first modern hospital. With 60 patient beds, operating rooms, modern laboratory, and X-ray facilities. Establishing a new full-functioning hospital was not easy in the early 1900s. Doctors in the valley first converted 2 large homes into hospitals. Working in these makeshift hospitals only strengthened the resolve of these dedicated physicians to establish the best possible hospital care for Cache Valley residents. David Clare Budge was born and raised in Bear Lake Valley. He earned both a dental and medical degree from colleges in Chicago, then helped put his brother Thomas through medical school.
Also traveled the world, going to Europe and other places as well as back east to watch surgeries and actually learn from the best of how to do things.
Their research and examination of these facilities helped them form their vision of what the Valley's first modern hospital should be. D.C. Budge believed the new hospital's purpose should encompass 3 things: provide the best care possible to patients, create a nurses' training institution where nurses could gain the skills to serve the growing needs of the community, and finally, a hospital that would be guided by a board of directors who would review and approve doctor privileges to work in the hospital. While not everyone agreed with the closed staff policy, D.C. Budge remained an advocate of this concept that was supported by the American College of Surgeons.
A hospital should be the guardian of its patients and therefore should not allow every Tom, Dick, and Harry to belong to its staff.
The medical staff policy was later revised and opened to any properly credentialed physician. D.C. Budge led a group of local physicians and businessmen in a campaign to raise money to build the Utah-Idaho Hospital. Nearly 300 individuals invested, with Drs. D.C. and T.B. Budge purchasing the most shares, knowing there would not be any financial return from their purchased stocks, but rather they would be investing in improved health care in their community. The profits of the hospital were put back into equipment and facility improvements, and a nonprofit hospital was born.
I think the amazing thing of the legacy that he left is the concept of having a nonprofit organization actually serve the community and help keep costs down for patients and families so that they can go somewhere to receive the best care.
Today, Logan Regional Hospital still follows a successful not-for-profit model of delivering health care that began nearly 100 years ago by these visionary physicians. The Roaring '20s were the age of dramatic social change. For the first time, more people lived in cities than on farms.
I'll be loving you always.
Many Americans were spending their money on ready-to-wear clothes and home appliances. In 1926, an addition was made to the Utah-Idaho Hospital, making it a 100-bed facility with additional operating rooms, nurses' quarters, and obstetrics. The name was changed to the William Budge Memorial Hospital. There were now about a dozen physicians on staff, and the hospital was steadily growing in size and reputation. An inspector from the American College of Surgeons declared it to be one of the
best organized and operated hospitals of its size in the 13 western states.
He was instrumental in helping the community to have the best physicians possible.
This was a lucky place for people, really lucky, because they did wonderful things. And way beyond their, I think, than their time.